I'm Stephen Gabel from Portland, Oregon, and I'm here with a patient who we did a hair transplant on yesterday. So how was the procedure yesterday for you?
So the procedure was pretty straightforward, relatively pain-free. It's comfortable. There were, I think, 7 people attending to me in total. There are lots of people checking in, making sure you're comfortable, making sure that you have enough lidocaine and you're not experiencing any pain, and everyone was really good about asking that I remain pain-free, asked if I needed to pause for a restroom break, making sure that the grafts were placed well. So there's really a feeling that you're being attended to, that people are attentive to detail, attentive to your comfort, and that the procedure is going to go off without a hitch.
And how about last night? How was your comfort and your pain last night after you left?
So I won't lie, it's not the most comfortable night's sleep you've ever had, but the pain's also reasonable given the fact that you've had an incision made in the back of your head. The clinic provides you with pain medications, so you take pain medications before bed. They give you pads to put in the back of your pillow. So I rested well throughout the night, woke up in the morning, came in for an appointment. So the pain starts subsiding already, and you keep ibuprofen in your system so the swelling goes under control. So, you know, the first night's the worst, but then it rapidly improves.
Great. In terms of your expectations, I know it's very early. You've done a lot of research in the hair restoration. How do things look for you?
So this is my 3rd procedure, and this is the only procedure I've had with Dr. Gabel's clinic, and there's a reason why I chose this clinic and not another clinic or one of the 2 that I'd previously been to. Of the 3 procedures I've had, I don't know if you can tell from the camera, the grafts are clean, they're not scabbed or encrusted with blood. The work is really meticulous. This morning I've already had 2 people, including Dr. Gabel and his assistant, look at the grafts, adjust them, look at angulation, because at this point they're not frozen in place. If there are little tweaks that need to be made, that can be done. He did that after surgery yesterday and then again this morning. So there's just a level of meticulousness and attentiveness to detail that's very consistent. No one's trying to get you out the door. And like I said, the work is very clean, very tidy. There's some swelling that's going to migrate downwards. But of the 3 procedures I've had, this result is by far the cleanest and the most really meticulous looking after the completion of the surgery.
Well, thank you very much for the compliments. A lot of times we have patients asking us, what is the physician's involvement? I tend to be a very hands-on surgeon. I want to make sure I'm with the patient every step of the way. What was your impression of my involvement yesterday?
Yeah, and this is why I would encourage anyone who gets a hair transplant to do your research, not just about the results, but about the doctor's level of involvement throughout the procedure. Because as you do your research, you'll find there's multiple steps through a procedure. There's the removal of the incision, there's the placement of the holes, there's the insertion of the grafts, and some doctors participate in the minimum amount that they have to. As you know, Dr. Gabel, on the other hand, is there placing grafts. He's supervising his assistant's work, he's supervising his technician's work, he's checking the cutting of the grafts as the procedure goes along. So there's not a sense, as there are with some other doctors, that people are there for the minimum and then they remove themselves, because a lot of clinics have 2 operating rooms. So you get the sense that you're being sort of attended to by assistants while the doctor's out with other patients. That wasn't the case here. Dr. Gabel spent his entire day with me. He supervised every step of the way. So I didn't feel that the baton had been passed to assistants or technicians so that he could free himself up to go be with other people. And I think that's a really crucial step when you're looking at a doctor, because you want to make sure that they're fully invested in your result and fully invested in the details. And they can't be doing that if they're spending 80% of their day with other patients in other rooms in the clinic.
Yeah, we pride ourselves on doing 1 case a day, every day. So in my case, yeah, we met early in the morning, at about 6:30 in the morning. We drew the hairline out together. Once you were set with the plan, we went back. I do all the injections. I take the strip. Or if we're going to do follicular unit excision, I do 100% of those. I did then all the numbing, made all the sites, and I placed, gosh, at least 50% of the grafts,
Right,
or more yesterday. Actually, probably a lot more. Probably about 2/3 of the grafts I placed yesterday. So. And then, gosh, we spent, at least half hour at the end checking them.
Yeah,
during
making
the procedure,
little adjustments.
Yeah, during the procedure, we're constantly checking to make sure, like you said, that the grafts are level, that they're curved the correct way, and that's just the time you have to take to make sure you get a phenomenal result.
I think the word, I called you finicky.
Finicky.
And I think finicky,
yes.
that kind of meticulousness, the finickiness, the attentiveness to detail, because not every surgeon is going to take that step, but those little adjustments, I don't know if you've done your research and you see other results, you see hair that grows out at funny angles, it goes up, it goes off to the side, the angulation doesn't match, And that's something a surgeon can tell after the procedure if they bother to take the time when the grafts aren't frozen yet and they're still adjustable, and you can make the little tweaks to ensure that all those little details that are going to be on your head for the rest of your life are just right. And if your surgeon doesn't do that, it's much harder to correct after the fact when you actually have to dig a graft out. So make sure that whoever your surgeon is going to be making that attentiveness to detail and spending that volume of time with you throughout the day.
We also encourage the patients to come back the following day. So he had his surgery yesterday, and you were here for about an hour with the staff already, washing everything, and then I come in to check everything. But they've already combed through everything. They had their loops on, checking all the grafts, making any adjustments today as well. So did you have that in your prior procedures, or not as extensive? Or?
To a lesser degree. And that's the thing too, is so many hair transplant clinics are volume shops, and there's this feeling that they want to push you through so they can see as many patients as possible. But it's an involved procedure, and unlike a lot of other cosmetic procedures, the recovery process is more involved. It's a long haul, and you want to make sure that all your post-care instructions have been gone over really thoroughly, because you can damage the grafts if you haven't been educated properly by your clinic. And so the level of care this morning has been really great, and after the surgery as well, to make sure that you know exactly what you're doing, you have all your supplies, so that when your grafts are still vulnerable when you're back home, you know how to take care of them, you know how to protect them so they're not dislodged, you know how to keep them moisturized, and all the things that are going to make sure that you have a really good growth rate after the fact.
Right, and that's the most important thing is if you don't have good care, if the grafts aren't put in well, if there's some type of damage during the process, or even afterwards, during the 10 days afterwards, if you don't have a good care regimen, you may not get the result you're looking for. So we're very strict with that. I give patients, I think it's a 16-page handout. It's not very difficult reading. It's very simple, and we spend time going through exactly how to take care of everything. So we had him lean forward. So as you can see, everything looks nice and clean right now. The staff spent about an hour with him cleaning the grafts. There's no blood or blood products around the area. Yeah, there's a little red hue, which is normal at this stage. There's no evidence of infection. The grafts have been checked. They're oriented correctly. And he has a little bit of swelling, which is normal. Some people swell more than others. For him, this is a normal reaction to have this much swelling. His skin is a little loose, so we expect that. But overall, this is what patients should look like the day after, nice and clean and ready to go. Everything's been checked. So, well, thank you very much for doing this interview with us, and I'm looking forward to seeing how everything is going to grow. We have some befores that we'll put, and we'll periodically monitor his progress. So thank you very much.
Thank you, Doc.
You're very welcome.